Hello and welcome. Today we're diving deep into a complex and challenging condition, cystic fibrosis, or CF. It's a genetic disorder that primarily affects the lungs, but also impacts other organs like the pancreas, liver, and intestines. Join us as we explore what CF is, how it develops, and what advancements are being made to improve the lives of those living with it. Cystic fibrosis is caused by mutations in a gene called the cystic fibrosis transmembrane conductance regulator, or CFTR. This gene provides instructions for making a protein that controls the movement of salt and water in and out of cells. When the CFTR gene is mutated, the protein doesn't function properly, leading to the production of thick, sticky mucus. A person must inherit 2 copies of the mutated gene, one from each parent, to develop CF. If they inherit only 1 copy, they become a carrier, meaning they don't have the disease but can pass the gene on to their children. The thick, sticky mucus produced in cystic fibrosis is the root of many problems. In the lungs, this mucus clogs the airways, making it difficult to breathe and creating a breeding ground for bacteria. This leads to chronic lung infections, inflammation, and eventually lung damage. In the pancreas, mucus blocks the ducts that carry digestive enzymes to the intestines. This impairs digestion and absorption of nutrients, leading to malnutrition. The liver and intestines can also be affected, causing various complications. Cystic fibrosis is most common in people of Northern European descent. In the United States, approximately 1 in 200 to 500 white newborns are born with CF. It's less common in other ethnic groups, but it can occur in people of all races and ethnicities. Because CF is a genetic condition, it is not contagious. The signs and symptoms of cystic fibrosis vary from person to person and can change over time. However, some common symptoms include persistent coughing, wheezing, shortness of breath, and frequent lung infections, very salty tasting skin, poor growth or weight gain despite a normal appetite, frequent grazy bulky stools or difficulty with bowel movements. Other symptoms can include nasal polyps, chronic sinusitis, and male infertility. Diagnosis of cystic fibrosis typically involves a sweat test, which measures the amount of chloride in sweat. People with CF have higher levels of chloride in their sweat than people without the condition. Newborn screening for CF is now standard in most countries and involves a blood test. Genetic testing can also be performed to identify specific mutations in the CFTR gene. If a child has a positive newborn screening test, a sweat test is always performed to confirm the diagnosis. While there aren't official classifications or types of CF, it's more accurate to say that the severity and specific symptoms can vary greatly based on the specific CFTR gene mutations a person has. Certain mutations are associated with more severe disease, while others may lead to milder symptoms. Doctors and researchers often discuss mutations in classes based on how they affect the CFTR protein and how responsive they might be to certain treatments. Currently, there is no cure for cystic fibrosis, but there are many treatments that can help manage the symptoms and improve quality of life. These include airway clearance techniques, such as chest physiotherapy, medications to thin mucus, antibiotics to treat lung infections, pancreatic enzyme supplements to aid digestion, and nutritional support to maintain a healthy weight. In some cases, lung transplantation may be an option for people with severe lung disease. A newer class of drugs called CFTR modulators are also available. These medications target the underlying defect in the CFTR protein and can significantly improve lung function and overall health in some people with specific CFTR mutations. Since cystic fibrosis is a genetic disorder, there's no way to prevent it from developing if you inherit the mutated genes. However, genetic counseling and carrier screening are available for couples who are planning to have children and have a family history of CF. These tests can help determine the risk of having a child with CF. The prognosis for people with cystic fibrosis has improved dramatically over the past few decades. With advancements in treatment, people with CF are now living longer and healthier lives. The median predicted survival age is now in the late 40s, and many people with CF are living well into their 50s and beyond. Research is ongoing to develop new and more effective treatments for CF, including gene therapy and new CFTR modulators. These advancements offer hope for an even brighter future for people living with this challenging condition. Thank you for joining us on this informative journey.